Tune in to NCN on Thursdays at 7 p.m. and the VOG on Fridays at 11 a.m. for the Ministry of Health's weekly program, Health Matters. This program seeks to educate you, the general public, on proper health-seeking behaviors while making you aware of the services available at the hospitals and various health facilities across the 10 administrative regions. You don't want to miss this. Tune in on Thursdays and Fridays. Be educated, be informed, because your health matters.
Welcome to another episode of the Health Matters program. This program is produced by the Ministry of Health. I'm your host, Alicia Martin. Today we're talking about cervical cancer, and with me in studio are a few persons from the Chronic Disease Unit of the Ministry of Health. With me I have Dr. Lachmie Lall. She is the Director of Chronic and Non-Communicable Diseases. Dr. Martin Campbell, Technical Officer for Cancer Control, and Nurse Donnickher July, VIA nurse, also attached to the Chronic Disease Unit. Welcome, guys.
Thank you.
Okay, could you tell us a little bit about your department and some of what you do there before we go into today's topic?
Okay, so the non-communicable diseases, chronic non-communicable diseases, one of the newest programs in the Ministry of Health, formulated in 2021, and it encompasses the departments of chronic diseases, which is all your diabetes, cancer, hypertension, all of those, the control of all those diseases. It also includes the mental health department and the drug demand reduction department as well. And so some of the work that we do is to firstly collect data on those diseases countrywide and to implement policies to tackle the diseases, introducing new technologies, training of staff countrywide to tackle those diseases, and also doing countrywide sensitization on what those diseases are and how we can essentially eliminate them or to reduce and to control the disease in the population.
Great, thank you, Dr. Lall. As you know, this month of January, Guyana usually observe cervical cancer. Could you tell us or give us an overview of the situation here in Guyana and some of the key components of the Ministry of Health strategy?
All right, so cervical cancer is a major issue for Guyana. We have seen over the years, we're seeing a steady rise in cases. 2021 has seen at least a 22% increase in cervical cancer cases. This was reported from the National Cancer Registry of Guyana, and Guyana has to position itself in a better positioning to tackle the disease, to bring better sensitization countrywide, particularly for our women population, encouraging our women to go out there to get tested, to get a simple VIA test, which this month, apart from all the other months, we are doing countrywide VIA testing. You will see those sites being published by the Ministry of Health's page, and we want to encourage the women to go out there and to get the VIA testing. If you don't get that simple screening, we don't know how to move on from there. Apart from that, the country is now working on its national cancer control and prevention plan, for which cervical cancer is one of the priority cancers in that plan. It's also aligning with the national NCD strategy that we are developing, and a large part of the NCD strategy will talk about the control of cancers, tackling and controlling cancers. We also are looking into the procurement of equipment. Apart from offering VIA services in the region, we also want to offer what's called cryotherapy. So recently we have procured 6 new cryotherapy machines, which we will be sending out to those regions, particularly the hinterland regions where we're seeing a larger number of cervical cancer cases. And this year also we're looking to procure additional equipment so that all of the 10 regions can offer those services. We do have a number of active sites, but we're looking to increase those sites because we want women in their community to be able to access that service at a center that's closest to them, that you do not have to travel long distances to get that service. Apart from that, we're looking to procure a more specialized equipment called a leap machine, which we will be putting at another site. At present, we have one of those machines in country, so we're looking to increase that number and to have the service available to the population.
Wonderful. You guys are doing quite a lot. So, Dr. Campbell, could you give us a brief overview of what the statistics look like in Guyana currently with regards to cervical cancer?
Okay, so cervical cancer, like Dr. Lall said, is a major issue for us in Guyana. Comparatively to the Caribbean, our incidence is at least twice that of the average Caribbean country. So for Guyana, we have an incidence of around 29 per 100,000 women. And mortality rate is also very high, which is around 15 per 100,000 women. So what that really translates to is around, let's say, 120 odd women every year developing cervical cancer. The thing about cervical cancer, why it's a bit troubling, is because it's a disease that's relatively preventable, very much preventable. And, these incidents, the high incidence and mortality in Guyana is troubling because we can prevent these cases from occurring.
Definitely. So we're going to go into a quick ad break and be right back with more on cervical cancer. Welcome back to the Health Matters program. If you've just tuned in, today we're talking about cervical cancer. Nurse Donnickher, could you tell us a little bit about cervical cancer, some facts about it for those persons who are listening, for those persons who are viewing our program today? What is cervical cancer and how is it caused?
All right, so cervical cancer is cancer of the cervix. Most persons refer to it as the mouth of the womb. It's basically where the cells, they start to grow and grow out of control. So the major cause for cervical cancer, of course, is previous infection with the Hpv virus, the human papillomavirus. So some facts about cervical cancer. Dr. Campbell would have mentioned that it's 100% preventable, right? So, and that basically links to screening. Of course, early detection saves lives, right? Another fact is that it's one of the most prevalent cancers in developing countries, right? Another major fact is that there's at least a 10-year period between pre-cancer and the actual development of cancer. So if we catch that woman in the pre-cancer stage, we can actually prevent cancer from occurring. And the last but not least fact is that almost all, which is 99.7% of cervical cancer cases, is of course linked to the Hpv virus. So we have risk factors. These include sexual activities. So if you've been indulging in risky sexual behaviors, having multiple sexual partners, that of course increases your risk or chances of coming into contact with the Hpv virus, right? If you have a relative, preferably a mother or sister with cervical cancer or ovarian cancer, of course, that increases your risk 2 to 3 times. And if you're immunocompromised, if you have HIV or you're using immunosuppressive drugs like corticosteroids, that in itself increases your risk. And of course, there's smoking and obesity, which is a risk factor for basically all the chronic diseases in Guyana.
Okay, so genetic is one of the contributing factors there. I heard you mention that.
Yes, family history.
Okay, and also one of the things that you spoke about is sexual activities. For persons who would have probably been involved very early, are they at risk of developing cervical cancer?
Yes, they are. So early sexual activity would be indulging in sexual activities before, let's say, the ages of 18. That in itself increases your risk.
Okay, so age is not an important factor there. Yes. What about smoking, tobacco use? Does that contribute?
Yes, smoking is a risk factor for, of course, all
NCDs.
All NCDs, all non-communicable diseases.
Okay, is there any other risk factors that persons need to know about? I know we hear so much about cervical cancer, but I still think that there's so much that needs to be said about it.
Yes.
So I think Nurse Donnickher would have responded to the key risk
Yes.
factors, but the important thing really to know is that every woman is at risk of developing
Every
cervical
woman.
cancer once you've been sexually active. Your chances of being exposed to HPV, the human papillomavirus, is there. Right? So once you've been sexually active, you're at risk, regardless of if you have a family history, if you've had, immunocompromises. So those things would add to the risk, but once you're sexually active, you need to be screened.
Yes.
Okay. What should women be aware of with regards to early signs and symptoms of cervical cancer?
So, generally, the signs and symptoms of cervical cancer are not apparent until the disease has progressed to a stage where little treatment is offered. So, in the pre-cancer stages, you really don't get any signs and symptoms. The late stages, you might have bleeding in between periods, heavier menstrual cycles, bleeding.
Some lower abdominal pain as
Wow.
well.
Yeah.
So that's why we're really pushing for women to be screened. Make that a part of your agenda every 2 to 3 years that you at least have a VIA test done.
Every
Because
2 to
you
3
really
years.
cannot tell what's happening there until it's too late, unfortunately.
Yeah. I heard you mention the stages for the cancer to develop. How long, with regards to years, how long would this cancer take to develop in a woman?
So cervical cancer usually takes at least 10 years to develop. That's in a normal immunocompetent person. Usually takes at least 10 years. So you would have to be infected with HPV. Normally, your body is able to clear that infection a little for most cases, but some women, that HPV infection will persist. It causes changes at the level of the cervix, the cells of the cervix, that can lead to cancer. So it takes at least 10 years, and
least
you know
10
that
years.
is telling you that you have time. If you're cognizant of your health and you're going for checkups, that there is time to detect those precancerous lesions before they develop into cancer.
And that can only be detected through
Through screening.
as Dr. Lall just mentioned. You mentioned HPV as well. Is this prevalent in both men and women?
Yes, but it's the women that develop the symptoms and eventually have changes to the cervix. The lesions, the cancerous lesions appearing at the cervix, the level of the cervix. But it's carried by both men and women.
Okay, for women who would have been diagnosed with cervical cancer, what treatments are available for them and how can they access these treatments?
So, firstly, any woman that's exhibiting those signs, it's firstly to determine at what stage the cancer is, and then treatment is decided. For those women where we're able to catch the cancer early, we can, like I said, have that LEAP procedure done on the women. For those women where the lesions are limited just to the mouth of the cervix, like Nurse July said, once the VIA is done, we're able to do cryotherapy, which is basically freezing those cells and preventing it from spreading higher up into the womb. For those women where the stages have gone a little past further stage 2 and 3, that's where they have to be referred to a higher institution, and they have to be seen and screened by the general surgeons to be decided if surgery has to happen, and then chemotherapy and radiotherapy after that.
Okay, so after diagnosis, the patient would be advised with regards to where they should go to get treatment and
Certainly,
so forth.
certainly.
What has been the response like, especially during this COVID-19 times, with persons accessing the services at the health facilities?
So what we noticed, and I think this goes across the board for the entire health sector, is that when COVID hit, we actually had a very sharp decline in persons accessing service. If due to fear of the unknown, what was COVID.
Contracting.
Also, I know due to a lot of healthcare workers being shifted to to work in the COVID response. So we for 2020, when we were just beginning the pandemic, we actually had a significant decline in women being screened. Just over about 1,200 women countrywide were screened for VIA. However, last year, with the added efforts from our providers and a little bit of reshuffling of the system as well, we're able to get back a bit better on track. So we were able to double that number from 2020. And that's considering all of the challenges, because lots of our staff are involved in the vaccination drive, are also working overtime at the hospitals to care and treat COVID patients. So we are seeing an upward trend now, and we're hoping to continue that throughout 2022.
Okay, great. So do you guys have any program specifically for women who are affected by cervical cancer? Does the ministry have any program that they can be involved in, probably at health centers or other health facilities?
So we do not have a specific program set up for cervical cancer, but in part of our training, in the VIA training, we do train our providers to give counseling. So they're on the specific days that they're offering the VIA service, they are required to counsel patients. And additionally, any walk-in patient that goes to the health center, there is a nurse on the ground that is supposed to be able to give counseling for VIA and for cervical screening. Any woman who has that fear that she may develop cancer is able to access that service with the nurse for counseling.
Great. So that counseling is available to them.
Yes.
I know the Ministry of Health has been talking a lot about prevention over the years with regards to cervical cancer and other areas as well. Nurse July, could you tell us a little bit about prevention with regards to cervical cancer and how can women get screened? What is this procedure like?
All right, so prevention, we basically offer VIA. VIA is an acronym for Visual Inspection with Acetic Acid. It's a simple test used to detect precancerous cells that have just started to change, right, for some reason. So we're looking for precancerous so that we can be able to treat it, right? The test is simple, it's easy, it's free, of course. It takes 1 minute and you get your results right away. So if it's a case that your result is negative, you'd be advised to return in the next 3 years. If it's positive, we offer treatment on spot. Dr. Lall would have mentioned the cryotherapy.
Yes.
It's basically where we freeze those cells and they usually go away. The treatment takes about 15 minutes and the VIA is just 1 minute. So 1 minute for 3 years to save a life, I think it's worth it.
Definitely. And what age, is there a specific age that persons have to come to do this test or?
Yes, so the age range for VIA in Guyana is 25 to 49. We usually do it before 25 if that woman has been sexually active for at least 3 to 4 years or if she has a child. And we do it after 49 years old if that woman is still seeing her menstruation. Because usually after menopause, the area that we're actually looking for, it recedes. So we won't be able to see it with our naked eye. So then we would recommend that woman to get a pap smear. But before, if she's still menstruating, of course, she can get the VIA done.
Okay.
And of course, for prevention also, we encourage, the vaccination against HPV. That's one of the greatest tools that we have for cervical cancer, for many diseases. But specifically for cervical cancer, vaccines are extremely, they're an important tool in preventing the disease in our younger population. The Hpv vaccine is still available at the health facilities. So if you have a young child, male or female, you can actually take them to get the vaccine, and it helps to prevent this risk of cervical cancer later in the future.
Definitely. And persons can also get screened for cervical cancer at our local health facilities across the regions as well.
Yes.
Correct.
Yes. All right. So we're going to go into another break and be right back. Thank you for staying tuned with us. As we wrap up today's program, what activities does the Chronic Disease Unit have planned for this month?
All right, so for this month, Cervical Cancer Awareness Month, the Chronic Disease Unit is collaborating with some of the other units from the Ministry of Health, including Women's Health, as well as we do collaborate with our external partners, GT&T, for example, and the other NGOs in providing services, providing screening for women. So we'll be having quite a number of outreaches, I think about 14 or 15 for the month. We already started yesterday at Kokwani in Region 10, and we're offering BIA screenings, we're offering breast examinations, we're trying to raise awareness basically on cervical cancer and how women in general can prevent and protect themselves.
Definitely. Before we wrap up today's program, do you guys have any word of encouragement to our listening and viewing audience?
So with this month's activities, we really want to encourage women to come out there. You will see a list of all those sites where we will be offering VIA services in the outreach program. And we will be coming close to health centers closest to you. And we want to see the women come out there and be screened. It is better to be safe than sorry,
Yes.
like they always say. Come out there, be screened, and just know that you can be at ease for the next 3 years until you're ready to do another VIA screening.
Right. So I would like to encourage women as well and families in general, apart from getting screening, encourage younger persons to get the HPV vaccine. Like I said before, it's one of the greatest tools that we have in preventing cervical cancer. And the HPV vaccine is available at your health facilities, all your health centers. You just need to go and ask. I know right now that is not the vaccine that is very much in the air in terms of conversation, but it's still there. It's still available. You just need to ask for it, and you'll receive it.
Nurse July?
I would just like to remind our audience that cervical cancer is almost 100% preventable, right? And I would encourage them to get screening because early detection saves lives.
Definitely. Thank you all for joining me on the program today. It was quite informative. I want to encourage you to keep up the good work that you're doing in your department at the Ministry of Health. Thanks once again.
Thank you very much for having us.
To you, our viewers, thank you for staying tuned. The Ministry of Health wishes to encourage those persons who haven't yet got vaccinated to go out to the facilities, to the sites, and get vaccinated as soon as possible. Remember to follow the Ministry of Health's Facebook page at Ministry of Health Guyana for more updates. Goodbye for now.